This is a paper out of New York that looks at COVID reinfection in essential workers. So it's seeing if multiple COVID infections over time has any impact on the incidence of long COVID. So if we're zooming out big picture and thinking about this, if you didn't have cumulative damage over time, the rate of long COVID would be the same for all of it because it would just be like a certain population of people, a certain subset of vulnerable people that would get it. But what we're seeing instead, and I'm jumping ahead a little bit, but what we're seeing instead is that the rate of long COVID increases with the number of infections that a person has. So this means that there is cumulative damage that's occurring that's allowing this incidence of long COVID to increase, or some viruses even being left behind, both very plausible, both has evidence for this actually happening from the other papers we've looked at. Now, diving in, this study looked at 2,511 essential workers, mainly first responders, that had a positive COVID test. This is either through PCR testing, through antibody testing, which shows that they had a previous infection, or through a rapid antigen test, all between March 2020 and February of 2024. A long COVID designation was defined through a questionnaire where people self-reported symptoms that lasted at least 2 months, and these were categorized as having long COVID, or PASC, post-acute sequelae of COVID. So this is a slightly shorter definition than we're used to. Right now, the standard is 3 months. That's the definition for long COVID, is having persistent, sustained, or relapsing symptoms over the course of 3 months or longer. And then they grouped subjects in the study that did not have a previous COVID diagnosis or whose symptoms resolved as classified as non-PASC, not long COVID. And from their 2,511 essential workers, they found that 403 of their participants developed long COVID, where they found 2 significant associations, the first being the risk of developing long COVID after multiple COVID infections, and the second one being unvaccinated at the time of first infection. This study was performed out of Stony Brook University, which operates 2 clinics in Long Island, New York, Westbury and Comic, where the data was collected over time through in-person questionnaires and surveys sent via text, email, and internal medicine records. There was also follow-up calls, and external medical records were obtained with the release of health information forms. And it's important to note that all of these are classifications of long COVID by participants in the study, where you have things like central nervous system issues, loss of taste, brain fog, phantom smells, metallic taste, loss of balance, vertigo, tinnitus, headache, migraine, numbness and tingling in the arms or leg, nerve pain in the extremities, anxiety, depression. You have sore throat, congestion, runny nose, cough, chest pain, etc. You have nausea, vomiting, diarrhea, weight loss, heartburn. You have musculoskeletal issues like body aches, back pain. You have fatigue. You have cardiac symptoms like heart palpitations, fluttering, and a rapid heart rate. You can be very tired, have low energy, and then have other fevers and rashes. This is just a small subsampling of what long COVID could be. There's over 200 symptoms. It's sort of an umbrella diagnosis at the moment, but it's sort of broken down into several different subsystems like the brain, the GI tract, the lungs, the vasculature, and etc. We've covered that in other papers. And notably, these long COVID symptoms were persistent or reoccurring from anywhere between 4 weeks and more than 3 years from the onset of receiving a COVID diagnosis and having COVID. So these symptoms can last for a very long time. Where this plot right here is sort of the meat and potatoes of the paper. So red is long COVID, blue is not long COVID. So this is either people that had no COVID diagnosis or had COVID and recovered. That's that group in blue. And what we see over here is that for one COVID infection to multiple COVID infection, this is the rate of occurrence of long COVID. So it was around 16-17% with one infection, but by the time you had multiple COVID infections, you had about a 30% chance of developing long COVID, and this increased. So then there's also the severity of disease when you got infected with COVID. So if you had a mild or asymptomatic presentation, your rate was somewhere around 10 to 12%. When you had a moderate COVID infection, that increased to somewhere between like 25 to 30%. And then when you had a severe COVID infection, this increased to anywhere between like 40%. So we have a clear increase in the severity of disease resulting in long COVID. That's been well established. Now, how does this relate to vaccination? So first off, if you are unvaccinated for first infection, So this is vaccination status at first infection. If you are unvaccinated and you have your first infection, you have a rate of about 25% of developing long COVID, 1 in 4. If you are vaccinated, you have about a 10% rate of developing long COVID, so significantly decreased risk. And what does vaccination help with? Well, it clearly doesn't prevent you from developing long COVID. There's still a low chance of developing it, even if you're vaccinated. That's because it doesn't stop infection itself. It just reduces the severity of disease. But if you're reducing the severity of disease from if you unvaccinated, you would have had a severe disease, and maybe you would have a moderate or mild disease with a vaccine when you first encounter the virus, then you would have a much lower risk of developing long COVID. So if you went from severe to moderate, that's about a 10 to 15% reduction in risk. If you went from moderate to mild asymptomatic presentation, that's about a 20% reduction in risk. And then if you had a mild asymptomatic case, you even have a small reduction in risk of about 5%. So this is something why vaccination is so important to reduce the severity of disease, even though it doesn't prevent infection. It does reduce the severity of disease, which reduces the incidence of long COVID. However, there is that subcategory that multiple infections, regardless of vaccine status or vaccination, will increase your risk of long COVID. So what we were talking about prior, if you were saying you have an equal chance of developing long COVID with every single one, we would expect this to be constant, but we're seeing an increased rate from one infection to multiple infections. And what does that mean? Well, that means that something is happening between infections that's causing the rate of long COVID to increase, that's causing a cumulative effect. And that's either you're not clearing the virus completely, that's either sustained cumulative damage from the prior virus, interaction with the virus. So you had the virus, you cleared it, maybe not, but it's sustaining damage on your immune system, on your blood vessels, etc., which means that when your next encounter with the virus results in either a more severe infection or it's resulting in an easier method by which the virus can pick up where it left off and cause even more damage until the point where you are now a person with long COVID. Now, one thing I would have liked to see that they didn't show in this paper would have been a breakdown of multiple infections versus one infection in vaccine status. So showing that one infection with vaccine, so that's what they did over here, but then multiple infections with vaccine to see how much that relative change is between the two. I would have liked to see that information. Maybe they didn't have it, I don't really know. But one interesting finding they found was that they did not find a significant association between long COVID and demographic factors, so things like age, gender, race, ethnicity, and educational level. They also didn't find a significant association between smoking status and other clinical info like body mass index, hypertension, and diabetes status. So from their data, it's really boiling down to were you vaccinated and how many infections have you had. That's really going to play into if you develop long COVID or not. And the last thing I think is important to emphasize that the safest way to avoid contracting long COVID is to prevent COVID infections themselves. So this is going to be things like wearing a mask, having good air quality measures, social distancing, washing your hands, and then also getting vaccinated, staying up to date on your vaccines, because we need to make sure that we're getting the updated vaccines to be the best protected against current emerging variants.